Hi guys, my name's
Hi.
Brandon. I work for the American Heart Association. What are your guys' names?
Enrique.
Aaliyah.
Nice to meet you guys. What brings you in today?
We recently went to the doctor, and the doctor told us we were hypertensive, and then we had a high risk of cardiovascular disease.
Okay.
So we just wanted to get more information on cardiovascular disease and the ways we can, some of the risk and how we can reduce those risks.
Okay. Well, let's start. Does your doctor, by chance, define what cardiovascular disease is?
No.
No? Okay. Well, cardiovascular disease is a heart condition that includes diseased vessels, structural problems, and blood clotting. There are several kinds, but the most common types among U.S. citizens include coronary heart disease, high blood pressure, cardiac arrest, congestive heart failure, arrhythmia, peripheral artery disease, stroke, and congenital heart disease.
So what are some of the risks associated with cardiovascular disease?
Well, there's
What are the
actually
risk
two
factors?
kinds of risk factors. There's modifiable, which are things that are in your guys' control, and then things that are your control are called non-modifiable. To start, we'll go over the things that you can control, and those are age, sex, that's gender, family history, and ethnicity.
Okay, so what are the things we can control?
Some of the things you guys can control are smoking. So, do either of you smoke?
Yeah.
No, that's good. Poor diet, high blood pressure, which applies to both of you if you guys have hypertension, high blood cholesterol, diabetes, obesity, physical inactivity, your stress level, and poor hygiene.
Okay, so what can we do to reduce these risks?
Well, as stated above, physical inactivity is a big one. So, ACSM recommends that you get a 30-minute session 3 to 5 times a week of moderate intensity exercise. That can include anything that gets your heart rate up. So, that could be running on a treadmill, going on a Stairmaster, running outside, Pilates, yoga, you name it. If it raises your heart rate, it's good for you. Also stated above was poor diet. By changing your eating habits, you can cross off obesity, high blood cholesterol, and hopefully lower your risk of contracting diabetes as well. So, to start, you guys can stop eating like salty foods, processed foods, fried foods, and then cut down on small things like candy, chips, and pop. Try to get 2 to 3 servings of vegetables and fruits a day. I know it sounds hard, but it's a lot easier than it seems. Half of your plate should be vegetables and fruits, and the other half should be carbs and protein. And how old are you guys?
21.
21.
21. Well, everything is good in moderation, and according to the World Heart Federation, 1 to 2 alcoholic beverages a day can actually lower your risk of heart disease by 30%. Anything more can be harmful, which is why you should be mindful of your alcohol consumption.
Yeah.
Consuming large amounts of alcohol can cause the heart to beat faster and the vessels to widen, and can damage the cardiac muscles. So those are the two biggest risk factors: are physical inactivity and poor diet. So if you guys can work on modifying those in your day-to-day life, you should be fine.
Okay.
Is there any other questions I can answer for you guys?
No, that's it from me.
No, I think I'm good. Yeah.
No? Well, it was a pleasure meeting you guys.
Right.
Have a nice day.
Thank you.